Hi, Jill. Hi, Brian.
Can you hear me now?
Yes, I can hear you.
Wonderful.
Great. Are you you're at the TMC?
No, no, I'm not. I'm not at the TMC. I'm from the TMC.
Oh, gotcha. Okay. Brian, would you happen to know Jill
Jill, yes. Jill's our safety evaluation engineer.
for Region One?
Yes, yes.
Thank you.
Peter.
I have 101. Thinking though we might want to give it another couple minutes. All right, I have 103, so I think we can get started. Let's go around and do introductions. Please include where you're from, because we have Parker doing notes for us and he doesn't usually do notes for us, so that will be helpful for him. Let's start with Brian.
Good afternoon. I'm Brian Menyuk from State DOT Traffic Region 1. I'm the TMC director, and I've also been the ITS coordinator for many years, in charge of design and construction coordination for intelligent transportation systems equipment.
Thank you. Tom Houlihan?
Tom Houlihan, Director of Planning, City of Rensselaer.
Great. Jill?
I'm Jill Lamanna. I am the Safety Evaluation Engineer for NISDOT Region 1.
Thank you. Mike?
Mike Dutry, City of Saratoga Springs, Planning Department.
Bill?
Bill Trudeau, City of Albany, Engineering Department.
Thank you. Andrew?
Hey, everybody, this is Andrew Sattinger from the New York State Department of Transportation, Traffic and Safety Program, HSIP program.
Thank you. Ethan?
Ethan Warren, CDTA.
Leah?
Leah Hines, New York State Department of Health, and I am an injury epidemiologist.
Thanks for joining. Mark? Well, Mark Castiglione is with the Capital District Regional Planning Commission. Chris?
Chris Meek. Chris Wallen, City Engineer, City of Schenectady.
Great. And in the room, we have myself, Carrie Ward, with the Capital Region Transportation Council, and
Robbie McHugh with the Town of Colony EMS Department.
great. And then Alex and Corey.
Hi, good afternoon. Alex Cohen with Cambridge Systematics.
Corey Hopwood, also with Cambridge Systematics. Good to see you all.
Thank you, everyone. So actually, the next thing we have on the agenda is public comment. So if anybody has anything they want to say, about regional operations or safety, now is the time to do that. Okay. Our main agenda item today is talking about the Capital Region Vision Zero Safety Action Plan, as we have been doing for the last few meetings. We're rounding the end toward having a draft plan, and so today we wanted to cover the draft safety implementation program that will be in the document. And I believe, Alex, are you sharing your screen?
Not yet. I will share that right now.
Okay. Corey, are you going to need to share your screen?
I don't think so. I think Alex has it. Thanks, everyone. Just make sure it's coming through.
Yes, I can see it.
Well, thanks, everyone. We wanted to take some time today to kind of walk through where we are in developing the safety implementation program, our multifaceted approach to creating a series of projects, programs, and other initiatives to help reduce fatal and serious injury crashes throughout the capital region. Also talk a bit today about some of the policy and process changes that we're looking to recommend and some of the priorities that we think are really some of the critical next steps to sort of build the capacity, build collaboration, and to get these initiatives further off the ground. Also talk about some transparency and performance management aspects as well. First of all, the safety implementation program. Want to talk first about kind of three elements that are really kind of part of the core of the safety implementation program. And really the thought is to create a balanced program of projects. I really want to compliment the Transportation Council for setting some funding aside for implementing the plan. No other MPO in the state has done that. I think that's a recognition of I think some of the enthusiasm and great input that we've been receiving throughout the process. So kind of the diagram on the right is both not set to exact proportions, but roughly in proportion as well. So in that, I mean, throughout the region, we're at about 45, 55. I mean, not split between fatal and severe injury crashes happening both on the state system and happening on the local system. And then conversely to that, on the sort of vertical axis is the need to balance both hotspot and hotspot and systemic treatment projects as well. So we've gone through and we've identified focus facilities, treatment packages to really support that effort as well. It's an ever-growing part of our practice. And, compliment Andrew and his team, all of other folks at NISDOT. And so it's something that it's been evolving over the last 5 to 10 years. So we think that's really a greater opportunity, particularly for some of the local jurisdictions to implement safety projects as well. And kind of in the middle there is cross-cutting. These are some projects, planning projects, strategies, so that we can support the roadway safety management process to keep the program sort of moving, continue to cycle through identification, diagnosis, development of projects, so that we continue to move the process forward in future years. So first, I want to touch about some the local hotspots. So as part of our network screening process, we identified through our network screening process, we identified 41 locations for street safety investigations. For our NISDOT folks, a slight play on highway safety investigations. So we've looked at 41 locations of these, and we've, for every location, we have seen some potential for safety improvement. Whether, so by seeing with these 4 locations that we see here is maybe some of the 4 major capital projects, they may become candidates for Highway Safety Improvement Program funds. But also what we've been really seeing throughout the rest of the investigations that we've been doing is that there's really a lot of opportunity for extending some of the pedestrian safety action plan treatments, for crosswalks, signal improvements such as leading pedestrian interval, left turn green phase priority. Lighting has also been a major issue, I think kind of across emphasis areas that we've seen. And then also I've acknowledged some ADA facilities and a few accessibility connections as well. So through each of these locations, we are developing street safety investigation reports, but these are some of the initial projects I think that we're seeing really emanate so far. So we think through this process, we have found some, standalone capital projects, but it's also reinforcing a number of systemic recommendations as well. Also, we've been developing, as many of you know, corridor concepts, taking a level of planning level designs for some locations. So really using safety and network screening as our genesis, using these rather than looking at perhaps assets, condition to come up with maybe some of our complete streets projects, really identifying those locations that have safety concerns, particularly those involving have been identified through the vulnerable road user screening as well as priority locations for further engagement, analysis, and refinement. So we've had a great experience working with these cities in the Village of Green Island to look at not just safety, but also some accessibility concerns. So really coming up with, we'd like to think maybe some different concepts and ideas that would have happened if we would have just, if these would have just gone through maybe the regular repaving process or even an active transportation plan alone. So we think that's been a great way of coming up with holistic project ideas. So just for a quick screenshot here is one of the examples of what we've done along Lake Ave and Saratoga Springs. A lot of treatments, particularly looking at what would have been our pedestrian projects, but also looking at issues related to signal timing and phasing to the left there at Lake Ave and Broadway. So we think it's been a helpful process, and we think these are really setting up for some good projects that may be, whether they're delivered through safety funding, whether they're delivered through other means. We think it's been a good way to generate project ideas. Also, we kind of haven't delved into the state projects so much. We are recognizing those projects that are currently listed on the upcoming 26 through 30 tip. And we'll are acknowledging that the new annual work program is going on as well. So kind of respecting that swim lane and process that Region 1 is doing on the state system. So I know their new annual work program is coming out soon, and they'll be working through that. And that's always continually ongoing. So we're really trying to match some of that similar process on the local system. For systemic projects, really excited to be trying to highlight, build upon and compile the work that's been happening at the statewide level through a series of plans coming forward. Really excited to hear Andrew mention that there's going to be an intersection safety improvement plan as well that we're continuing to adopt and incorporate more of FHWA's proven safety countermeasures. So we've have a comprehensive list of treatment packages that grouped by focus facility that are searchable by focus facility, HSIP eligibility, countermeasure type, and particularly also deliverability. So, whether looking at projects that can be delivered through different sort of contracting mechanisms or types of projects. So those are maybe signals, markings, or projects that may be, other capital intensive work. Always want to acknowledge that individual locations will require some field evaluation. It's not something, we can totally do on our desktop. And there are also some enhanced packages as well, too, similar to what the PSAP and the Roadway Departure Safety Action Plan have done as well. So recognizing sort of the layering of what can be done at areas with either higher risk factors or areas of other, concern and interest, higher maybe observed crashes as well. So what we've just really, the systemic factors really boil down a couple of ways into really two geographies that we have in the GIS files. Those that are located at intersections. So our two focus facilities of intersections and pedestrians our focus facilities are focused at those geographies. One, for intersections, kind of looking at angle crashes and general risk factors at intersections. And for pedestrians, recognizing that about 2/3 of our fatal and severe injury crashes are happening at intersections as well. So really trying to prioritize those as opposed to mid-block segment related crashes. Across here, we see that there are some focus facilities where there are overlap. So that does provide the potential for layering on additional treatments that may have, some cumulative risk factors. I mean, it may have some cumulative risk reduction. For example, at an intersection, we might be looking at doing backplates and crosswalks. Lighting might be beneficial for both, for all system users, drivers, pedestrians as well. And what we have is that we've identified locations that have above average number of risk factors respective to each focus facility. So urban signalized intersections with 4 or more legs, stop control, they may have different numbers of risk factors based upon those geometric or operational characteristics where there's been above average crashes at those locations. So what really the hope to do here is, I think through these is to, and I can flip over to some web mapping in a bit, is just that there's not, so many, where do we even begin, but to start to begin to narrow down from where we have some average number of risk factors, where there's maybe, there's locations for both. Those might be promising projects. And those that, those that are part of vulnerable road user high risk areas as well. Also note too that these are broken down by facility, just some of the general facility owners. So we see here that these could be some NISDOT projects in the cities, probably some of the cities there are, and actually the vulnerable users in Albany, Troy, Schenectady, those 70, so there are some ways that we can look at narrowing down lists of potential improvements. Similarly, for the roadway departure and speed related focus facilities by owner type, we have a lot of crossover in terms of the focus facilities. But what we see here is that both counties and towns, there's really opportunities for them, particularly in regards to roadway departures, to look at deploying potential countermeasures, those that we see in the current roadway departure safety action plan. And also, we note speed as well, because speed, about 40% of all roadway departure crashes have speed as a primary contributing factor. So let me I'll take a quick second just to kind of flip over to web map here. So if anyone has any questions in the meantime, feel free to.
Alex wanted to highlight that Andrew mentioned in the chat that Clear is now allowing for network screening of all severity groups. Great update for the hotspot predictive network screening.
Great. And I know, this analysis is a bit different than what is part of Clear Safety for their systemic screening, but we think this is pretty complementary, and look forward to, using that process more in the future. So just kind of highlight, so really, I mean, this is a huge amount of the network by looking at some of these locations, but as we begin to look at some of our, the above average risk factors, we do, quite probably narrow down the amount. And then as well as if we look at, pedestrians with above average risk factors, if we look at some of our signalized and stop controlled intersections as well, we do see, some of the opportunities that are available for, respective facility owners. We'll share some of this web mapping here later today. Just to jump back to the main presentation. Another one of the key, kind of outside of some of those key hotspots systemic. So one of the other pillars of the implementation program that we're looking to do is to really reintroduce and strengthen safe routes to school. Though not a standalone program anymore, it's been there's still a lot of opportunity to work in those areas and really sort of mirror some of the work that other states have done. So what we did was really acknowledge, analyze some of the key roadway segments that are within a quarter mile of the streets serving each school, as well as collectors and arterials that intersect those primary streets, serving the front doors of each school. So these are great opportunities for focusing on, recognizing where we need to have sidewalk upgrades, look at crossings, inventory, school zone signage, look at speed management in those areas, support crossing guards that are required for school zone speeds, and also as areas to target for safe routes to school education programs as well. Another issue that we've been looking at, and I thank Ethan with CDTA, talking about looking at isolated transit stops. What we wanted to do was find those areas, those stops that aren't at major intersections and really away from safe crossings. They're really the locations of mid-block, darting across the road. So these may be. So we have looked at areas that are about 500 feet away from all intersections. We're going to try to narrow this down to some more, actually broaden this to, even though a spot may be at an intersection, really kind of two-way stop controlled intersections as well, Ethan. So I'm going to broaden this for you. So we do look at some areas along roads above 10,000 average annual daily traffic, and 4 lanes, so that not just those that are maybe further out on long suburban arterials, but really kind of also finding some stops where that risk is also there. We think this is a great opportunity to look at, possibly creating new mid-block evaluating for new mid-block crossings, in alignment with FHWA and NISDOT guidance. So maybe we're looking at initially high visibility crosswalk markings, lighting in those locations, and possibly further upgrading to RFBs or even pedestrian hybrid beacons where the demand and for crossings exists. For GTC, on the programmatic side, for supporting education and enforcement programs, we've wanted to focus on local programs, those opportunities that regional partners are able to participate and support. And these really fall into 3 key flavors across the state, per GTCC's grants programs, one for police traffic services, child passenger safety, and general highway safety grants. Those are the really flexible, interesting ones that we can explore. So we did some analysis. Not sure it's too much analysis, but just really kind of taking an ugly PDF from GTSC and trying to put together how this region of all 4 counties has performed and received certain grant funding. And what we want to do is to understand that, how we can try to expand further participation in police traffic services. So in certain high enforcement weekends, like the one we just recently had, is greater coverage throughout the region. Child passenger safety, we know that we have issues with compliance and kind of reaching out into lower income, lower English proficiency communities. So, looking at maybe additional partners that can help us reach into there. And highway safety grants, there's a growing number of unique partnerships and some programmatic ideas that are happening elsewhere in the state. And we do have some, unique partners here that have really taken it upon themselves, and the Department of Health in Albany County and Saratoga County. It's really kind of the overall managers of a broad range of educational programs. In some other areas in the state, there have been other active transportation groups, other community groups, even religious organizations that have taken part in this. So we think, taking advantage of further highway safety grants might be a way to kind of bring more of those potential partners into the fold. Just kind of highlighting some of those additional future opportunities. Other areas of improvement too, we'll be looking at leveraging more of GTSE's motorcycle safety education, trying to find ways to further that message and identify maybe other local partners in the community. And one of the key policy and process recommendations that we'll be talking about coming up here next will be looking at, kind of convening more of these partners together. So, sharing more of this knowledge across the 4 counties, which tends to be siloed amongst each of the county traffic safety boards, or that, kind of meets up at the annual conference each year to see if there's some, more further opportunities and to kind of continue to grow and support knowledge transfer in these areas. And lastly, some of the cross-cutting projects, what we're looking to do, recommending, with, potential support through HSIP, without maybe picking up any funding source particularly just yet, is recognizing some of these key processes that help bring local ideas and identified safety issues kind of from off the map, off the out of conversation into reality. And so really taking those first steps of conducting the required safety investigations for other locations, working with partners to go through a whole road safety audit. And thirdly, to enhance data collection where there's maybe some value of furthering that at the regional level, particularly focusing on vulnerable road users, continuing to support their counts program, and also to work with other partners to monitor, track emergency response as well. So bringing more of that data of crash outcomes into the overall crash records. I want to pause and see if anyone has any questions.
Hey, Alex, this is Andrew at New York State DOT.
Hey, Andrew.
Can you tell me a little bit about how you initiate the highway safety investigations? How does that happen?
Sure. So for the street safety investigations that we did for this process, we reviewed the CLEAR network screening results with some of the key grant partners, as well as looked at outside of those areas as well. We kept a focus on, so actually we used both the fatal and severe injury screens
Oh,
So-
I was thinking more of like the consultant side of thing. Like, are you contracting with a consultant for those, or are those in-house, or
Yeah, one of our Stantec is a partner in our team, and that was actually part of the scope. So that's really the heads up play from the Transportation Council to include that and support that. Because I think if we take a look at the roadway safety management process, that's kind of like the wall that, has.
yeah, that's key. And
Yeah,
are you funding? You're funding that with just your MPO funds?
that was part of the SS4A grant.
Oh, okay.
And I could chat offline about some other things that we did when I was part of GTC as well. But so that's which has sort of helped some of those local agencies do some of their own investigations.
Gotcha.
Kind of quality.
Yeah, I mean, I'll just mention quickly why I was curious, because I know you guys have said that's a big need kind of a lot, and it's difficult sometimes to get that all set up before you even have a project or anything in mind, kind of thing. But I've been looking into here at DOT if there's a way that we have term agreements with basically the scope is highway safety investigations, funded with HSIP. We do have a design service or engineering design cap on how much the department can contract for design and engineering services for the whole department. So it does contribute to that, but I'm looking in to see if that's something that we could offer, and if that would be useful to the MPOs. Like if you could say, hey, we have this site, we think it's bad for whatever reason, we can assign it to the consultant that way, and they would provide you then the the whole thing that goes to our design people, like the IPP, FDR, design approval document kind of thing. Is that, I mean, is that what the highway safety investigations here is basically doing?
Yeah. So I guess we were filtering by, obviously our level of service of safety. Then, kind of maybe putting some pearls on a string of, maybe some multiple intersections or an intersection and a segment. And
yeah, defining a good kind of project area with related facilities. Yeah.
A little science and a little art.
Yeah. Engineering judgment, they call it, right?
Yeah, engineering judgment and looking at, areas of interest as well. So, and also kind of making sure that we were also looking at some of the PSI as well, potential for safety improvement, because there were some locations where they might have been 3 or they might have been 4, but you kind of dig a little deeper in there. There was maybe some higher PSI.
Yeah. Well, I mean, do you think that would be something worth pursuing for us to, I mean, especially if you've got local municipalities, little, towns or something, that if they don't have the staff and the resources to just generate that investigation and the project proposal, then they're way behind the ball. But if we can get them to that point with just their agreement, like they agree, yeah, please do that for us, then we add it to our list, and we'd have to do some kind of something on our side here to make sure, is this eligible? Is it, are we doing it fairly across all the MPOs, that kind of thing? So just some details we'd have to work out, but there'd be no paperwork, contract stuff. You just tell us, then we make an assignment to our contract, and they provide those documents in the end, which then, should be able to stand toe to toe with any state projects that are going up against the tip, because it'll have all that same, material. Just something to think about.
So Andrew, I think that sounds like a good suggestion that maybe we could put into our recommendations even for this plan. because I think he's shortened things here, but essentially for like the highway safety investigations, the recommendation is like to continue doing them. I think it says on an annual basis. But so we've heard this HSIP evaluation, using HSIP funds to do an evaluation to determine, you know, what an HSIP, a possibly HSIP funded project could be. But would that, if we use HSIP funds to do the investigation, does that then mean that the muni or us would have to pay those funds back if we didn't progress a construction project within 10 years?
That's a good question. I mean, yeah, we would want to make sure that, you know, if someone's asking us to study a location, and it comes out that yeah, there's some potential there and there's some good recommendations, and they're, we could always do it with a HSIP kind of focus. So like, we want this to be a fully funded HSIP program. So tell us what can be included in that, we could do it that way. But yeah, we would want some, I mean, because it would involve the town, obviously, or muni, whatever, to coordinate construction, and there is the state match, which maybe we could help with the toll credits and stuff. But that might be a good way to get them, to make sure that they're going to follow up with the project, is if they put in that 5-10%, whatever. So I don't know. Yeah, we haven't really worked out any details yet, but I'm just always trying to find some ways to get more help out to everybody, spend some funds and save some lives.
So what if, so like we did these 41 and we came up with mostly the systemic recommendations. Would that still work? So if you all did highway safety investigations for local governments, you did 10 of them and all 10 of them come back saying this is really not worthy of like a significant capital expenditure, but it's, add some lighting and some signage, would that still be eligible in the same process, or would that be kind of irrelevant because it would just go to a like a PSAP funding round or something like that?
Gotcha. I think there's couple opportunities actually. Like we said, the systemic stuff is better for the local system. A site project is only going to reduce those crashes right there. So everyone always says the systemic is better for the local. So that was actually another idea I was having, is if rather than putting out an action plan saying, hey, do all these roadway departure locations, what if we just kind of at the main office, through our contracts and stuff, came up with, let's say this year we're doing the proven safety countermeasure from FHWA. I believe there was one for, it's like a package of treatments for stop controlled intersections. What if we said, we're doing this, anybody that wants to submit a location, send us the location, we'll review them and use our tools, PSI, LOSS, things like that, to determine what's eligible, and then we would just kind of get an agreement with whatever municipality, MPO, whatever, to then go implement that countermeasure at every available location. Because I think we're trying with these action plans, we're end up sticking you guys and the locals with all the paperwork, all the analysis, kind of eligibility, prioritization, all that kind of stuff, when what we want is just systemic implementation, as wide as possible. So, that's where I'm headed, is, can we just kind of pick these and we might do it region by region, because obviously there's some different priorities in each region. But we're thinking like maybe, pick a region, pick a pilot proven countermeasure and say, do all the municipalities here agree? We'll update all these stop controlled intersections with this package, you know. The
Yeah, so
coordination would have to be there, but yeah.
I might throw that out to this group here for those of you who are at a local government, if that sounds like something that you would be open to. I mean, he's basically saying NISDOT would come and do work at your intersections.
I don't want to speak for the city, but that sounds great. A lot of times, the paperwork and the eligibility and the dollars gets in the way of implementation, at least on Saratoga Springs' end.
Just from what I've experienced in Colony,
Go ahead, yes.
sorry, just from what I've experienced in Colony, not having an actual engineer focused on roadway programs, like it sounds like that would be a great opportunity to have somebody do the engineering legwork. And what would be involved for the local municipality in the funding? Is it just the local match or?
Yeah, I mean, I think we'd have to probably put together state local agreements, just because it involves, you know, work on the local system by us kind of thing. And I mean, we do have the toll credits that we use to fund local projects a lot, but like I said, I think it would be good to have a little skin in the game for the muni. I don't know exactly how all that paperwork works out and stuff, but if it was easy for just, you know, to get that 5% from the municipality and we handle everything else, you know, I will definitely see if I can make that happen.
Yeah, I mean, from a local perspective, it sounds great. I've had a lot of conversations with traffic safety and just hearing the frustration of, we know there's certain intersections that need to be looked at. It's just the engineering part behind it and the logistics of having the contractor come out and actually execute the plan.
Well, and the good thing with a lot of these proven safety countermeasures is that engineering is done, you know, as long as it's the kind of facility. A lot of these are low cost countermeasures, you know, so it's not, you know, it's not going to need the engineering kind of analysis, you know, site by site, hopefully. And then when there is kind of some engineering analysis, you know, we do have our new traffic engineering bureau here we're going to work with to, if there is some kind of like engineering drawings that need to go along with certain countermeasures, we can put those together. So it's like, if your intersection looks like this, you could do that. If it looks like this, you can do that. You know, that's what we heard worked for PSAP. So we're trying to get back to that kind of easy plug and play kind of project.
Oh, great.
Bill, were you trying to jump in there? I had seen you unmute.
Yeah, conceptually, I think that's great. DOT is offering this, and we certainly want to work with DOT as we do on a regular basis. So, say conceptually, that's a great concept.
Yeah, hopefully, before I get anyone's hopes up, you know, I gotta make sure everything works out with FHWA and all that. But I think everyone is all on board, you know, for trying to find ways to help get these more local projects going. So I have good feelings about it. Are you muted there, Alex?
I'm sorry. I know I've had good success in Region 4 using scoping phase for investigations without kicking into the 10-year PE rule.
Yeah, well, I didn't want to hijack the meeting or anything, but I love to see plans come together, and we're always working on some plans here. So hopefully, you know, we can, if they don't get into this kind of in this plan, it's stuff that we can work on for future plans.
No, Andrew, that's wonderful to to discuss that. And I think that opens up the range of partners that can be involved. So that's, from whether locals or the NPO, or to have DOT be involved in helping to facilitate and fund those. That's great. Does anyone else have any other questions, comments? Some of the time I wanted to highlight, we've been touching on some of the policy and process, and getting perhaps even some new processes today discussed. But just kind of a bit of, how the plan looks at these ideas of ranging from policy, processes, the work that we're kind of doing in the planning and analysis and project development into, what are the projects and programs we have on the street. So we have a policy and process framework. So really emanating from the Vision Zero commitment itself, and then working, with a kind of the next level, supporting that policy and being the, kind of torch bearers, is really the Transportation Council serving as Vision Zero coordinator, and with, working with ROSAC and other partners, and then kind of across supporting these 7 general process areas.
Hey, Alex, can I ask one more question? This is Andrew again.
Yeah, go for it.
You guys mentioned the safe system approach there earlier too. I was just wondering that level there you have with the Vision Zero coordinator and ROSAC there. We're kind of trying to figure out here at DOT how we organize people around that safe system approach, and I didn't know if you had put some consideration into that, like who's the safe road person, who's the safe driver person, who's the safe post crash care person, whatever the others are. You know what I mean? It's FHWA says that safe systems approach is how we get to Vision Zero. So I'm just trying to figure out kind of, is that a structure? Are those people? Are those processes? I don't know.
Yeah.
I'm just looking for some.
No, and we've identified in the plan itself, and talking about, we've identified each of the safe system elements that that these align with and support.
Down at the bottom. Yeah.
Yeah, I mean, we haven't quite. We've leaned away from organizing, all of the plan in that way. And I think we have gotten, speaking in more of these colloquial, areas has been kind of helpful too, I think, with some of the engagement of different partners too. So.
Oh yeah, they're not going to know what the safe road user means, or anything. But
I think it's been helpful throughout the planning process to make sure that we're not forgetting that, and thankfully always seeing Robbie around, make sure we never forget our post crash care.
Yeah,
he's a rarity in a lot of these groups.
Okay.
So
Yeah, no, I was just looking, our commissioner is really into the safe system approach and everything. And, I'm just trying to find ways to make it work for us,
Yeah, I don't know if we've settled on any model sort of X's and O's formation for anybody yet.
Gotcha.
And that's
Robbie wanted to chime in on this.
Yeah, Andrew, thanks for that comment, and other Andrew. or Alex, thanks for that comment, Andrew. I've heard people at a national level talk about the safe systems approach and focus on the one kind of the circle that surrounds it, saying a shared sense of responsibility. So myself as a paramedic, I could just focus on post-crash care elements, but at the same time, I've gone down this rabbit hole of looking at intersections and safety and lighting and talking with traffic safety about safe speeds and having these conversations, at least that spur more conversations and more ideas about, well, what are some proven countermeasures that could help us in a community look at the speeds? And so while I don't think there's any perfect answer, at least getting more stakeholders at the table with that sense of shared responsibility. One example that's coming to mind is in the post-crash care world, the idea of whole blood. There are only 200 ambulance services out of about 12,000 right now administering whole blood. These patients are dying on roadways that for every minute saved in getting that unit of whole blood, that transfusion, their odds of mortality go down by 11%. So it's fascinating to think about, at least I think it's fascinating to think about, okay, well, how do we have this shared sense of responsibility? We could take it on as our own responsibility, or if we could get folks like NISDOT, Department of Health on board and say, this costs $1,000. The blood is $650. The total administration for a unit of blood is $1,000 per unit. How can we come up with ways to offset that variable cost? Not everyone is going to be getting blood transfusions, but for those critically ill and injured people on our roadways, is there a pot of money to draw from that would enable more stakeholders to embrace this idea? We can come up with funding mechanisms for the blood coolers and the blood warmers and the regulatory hurdles at the state level. But like that one particular area is an interesting one that a lot of people are concerned about, is like at $1,000 a unit. Is there some other pot of money that NISDOT could help out with, or that DOH could even reimburse a portion of? And then I could set a lot of people at ease saying, hey, this is a highly regulated program with a lot of really good benefits, and we've got buy-in from multiple stakeholders that are behind this idea. So
yeah, that's very interesting. I remember there's something similar like that with the gates, where the ambulances can access like the interstates and things like that, the full access controlled highways and things like that. So that if they can get, past all that traffic and get in one of those gates. And so we did a bunch of analysis to find out, are those gates spread everywhere? Is there one at least on every major highway kind of thing like that? Yeah, there's a lot of research we can do with the crash analysis and then combine it with, some other, funding and processes after the fact. That's good stuff. Yeah, we'll keep working on the safe system there.
All right, Andrew, we'll be happy to follow some time here. We can, share some statewide perspective and kind of look at different formations. Sorry for the football analogy, but seeing different lineups in different places.
Yeah, we'll punt for now.
Okay. Just to review some of the priorities, particularly these focused on some of the near-term actions. Looking at really with the Transportation Council and some of the members here being identify some of the lead agencies and some of the supporting partners. So looking at first, continuing to promulgate Vision Zero policy, looking at supporting communities, jurisdictions, even public-private entities to be involved as well as sharing out the Vision Zero annual report, working on the monitoring progress to see how, where we're on towards zero, giving credit towards those activities and actions that have been taken in the previous years. I think kind of what we talked a bit about in some of the roadway safety management process is making sure that we're connecting the dots and the steps. And that's for the, sharing the network screening results, supporting an annual work program as well. Andrew, I think we can probably more confidently try to put you guys in the as a supporting partner, as well as maybe even looking at seed funding as well too. So where there, so if we see some positive benefit cost coming out of the investigations, maybe looking at getting some of these projects more shovel ready. And lastly, for roadway safety management, amongst other recommendations, building out a inventory of horizontal curves, in support of the, reducing roadway departure crashes through systemic countermeasures. Complete Streets, really kind of continuing to support a lot of the data development and inventorying to really help prioritize those locations, and that really helps, to cross-pollinate with the safety analysis. Also for roadway safety management, it should be speed management, collecting, additional speed data and supporting, continuing to support the, some of the local speed studies we've been doing for jurisdictions. And on education, working with, convening that annual meeting of GTSC grantees and potential other partners as well. And then funding, helping to guide those potential safety projects through the TIP process, or helping to guide folks through more systemic applications as well. Any questions, comments?
Alex, did you happen to get the federal aid funding 101 that David Orr put together at Cornell Local Roads the other day?
I've seen that in the past.
Yeah, I sat in on the webinar last week, or was it this week? Anyway, very thorough. The document, the whole document walked you through from beginning to end. The whole process and contacts and things like that. Happy to share that around if people haven't seen that.
Okay. Yeah, I think that's very, very much concurrent with getting non-frequent flyer sponsors to into the federal aid process. Any other questions? All right. Really aiming for probably around end of summer will be the implementation program annual report. It's important for us to track sort of which direction we're going towards zero fatalities and serious injuries, zero fatalities and having serious injuries by 2050. Also monitoring, some of these priority policy and process actions that we're doing, highlighting, capital projects and other achievements throughout the region. We think that's a good to be timed with the annual performance measures adoption that that comes from Andrew and that each MPO has to do as well. So it's a great opportunity to take stock of where, where progress is being made, tracking, and, using that as a time for a bit of reflection and conversation.
Hey, Alex,
Um,
can sorry to interrupt. I just, I didn't know if you were aware, because we're under penalty, from our fatality stuff with FHWA, we actually have to do an implementation report and the annual report, which they're kind of useless because they're due within a couple months of each other. One says what we're going to do next year. One says what we just did. But anyway, I didn't know if you guys have ever seen that implementation report. It goes to the feds and they make us, calculate a lot of stuff, how much we're spending on this or that, state, local, which area, which crashes, all that kind of stuff. And it's statewide numbers and everything. So if I don't know if that's been a use to you guys, but I just thought I would throw that in there because
Andrew,
that's our report, for the whole state.
Andrew, have you had to do this in the past, or is this the first year that you've gotten hit with the FHWA letter?
We've been doing it since COVID, basically.
Okay. I mean, I think
Yeah.
that's the case for most states at this point.
Yeah, I was just
After
looking
everyone
at it.
realized that you can kind of recycle the implementation.
Yeah,
But-
we do. I mean, you gotta update all the numbers and everything, and pay attention to them. If the
track down the
trends,
expenditures, that's always the fun part.
right,
Future
and
expenditures.
the justification. If a new thing is trending and we're not, responding to that, that gets highlighted in that data there. So.
I don't know. I think
mean,
from the MPO's perspective, I think it's generally nice to share out, how far we are off from hitting the statewide numbers and if the methodology for calculating the targets is changing at all. I know you share that information out already, but just kind of highlighting that here in the summer as kind of a heads up for when those targets are due or the adoption of those targets are due and, later next year. That's the only piece I think that's probably helpful at this level.
Yeah.
And then, if you have any information ahead of time on like the planned or obligated expenditures for the upcoming fiscal year information that you have to put in there. If you have that, that's also just generally nice to see where priorities are at, I think. Though I know that ends up being a public document that we could access anyway once it's approved by FHWA, but any heads up to what we're doing here.
Right, it's kind of too late by the time
you
can get it from FHWA, right? So yeah, we can share that with you early. It's just from our planning, group.
Yeah.
And actually, if you want, you could look in. Unless we kind of hid that away. Some people were concerned about some of the OPPM, the capital project information in clear there, but you could look up all the stuff that's being let and stuff that way.
Mm-hmm.
I'll be happy to share that. And we're working on it right now. So if anyone wants to see any of that information, we'll share. That's due June 30th. So
Great. No, we'll take a look at that. I haven't looked at that additional report in a little while. In addition to some of the 5 key performance measures that that have become institutionalized and part of our annual routine at the regional level. Also looking to note a couple of additional performance measures. Fatalities and serious injuries by functional class. Just kind of a helpful breakdown of where we look to identify some, noting that where we see on the NHS, sort of our federal aid and local systems. Also looking at fatalities and serious injuries per an equity priority as opposed to capital-wide average. Just want to make sure that we get, track that so that ratio, hopefully over time compresses closer towards, 1-to-1. So these do, being in the implementation annual report kind of as a companion document, just as an overall tracking document, that, doesn't affect any of the, compliance or efficient support for NISDOT's targets. We will also work to send out a draft local resolution template. We've worked with Carrie to have a draft regional statement. So looking towards local jurisdictions and others to just indicate their support, just as an optional resolution for highlighting support for the plan once adopted, as well as support for the overall goal. That's it for us today. Any other questions?
Thanks, Alex.
Thank you, everyone.
So just
Thank you.
kind of closing up on the Vision Zero topic, we'll be looking to have a draft plan to our planning committee for the July meeting. And then we're kind of tentatively planning to hold our third round of public meetings mid to end June to talk about basically what we went over here today. So the recommendations in the safety implementation program. Other updates that we have on the agenda for In Motion, there was a link in the agenda. We're still working on that. It's progressing. The transportation improvement program was approved by our planning committee, and it will be at our policy board next week for their approval, and then hopefully incorporated into the state tip by the end of September, so that projects can be progressed then starting in October. There's a technical assistance program. We have recently completed a number of those, so we wanted to highlight that there's no application deadline, but you can apply anytime, and that's for small scale transportation and community planning initiatives. It's on our website. If you go to programs and then local programs, then there's an option for a technical assistance program in there. And so the final thing I have is just that our next meeting will be August 28th. Anything final before we end? All right, well, thank you for joining us, everyone. Have a good rest of your afternoon.
Thank you.
Thank you, everybody.
Everyone.